Hi, I'm Bella Primavera, and this is my project on skin cancer case project analysis. Today I'll be comparing two major skin cancer campaigns using the CASE and the RIPE framework. My goal is to evaluate their research, planning, implementation, and evaluation, and explain which campaign demonstrates stronger communication strategy. So why these campaigns? My two campaigns are the National Skin Cancer Action Week, which is an annual UV safety campaign, and the Miles for Melanoma 5K, which is a fundraising series supporting melanoma research. Both the Skin Cancer Action Week and Miles for Melanoma campaigns share the same overarching goal: to raise awareness about skin cancer, prevention, and early detection. However, they approach the mission from very different angles. One focuses on public health behavior change, while the other centers on community engagement and fundraising. These are good for comparison because the goals are different. One is prevention focused and the other is community and fundraising focused. I picked these because they tackle the same overall health issue, but through very different communication strategies, which makes them interesting to evaluate side by side. On to our research. To start with National Skin Cancer Action Week, before developing the campaign, it's important to understand how Australians currently think and behave when it comes to sun safety. Research should explore awareness levels, daily habits, and the main reasons people either do or don't protect themselves when UV levels are high. So starting with research, the Australian campaign is definitely more data heavy. They use national cancer statistics, UV exposure data, and even hired YouGov to run a survey about how often people are using sun protection. So some areas we're going to explore when we research this are: how often do people use sun protection, like clothing, sunscreen, hats, sunglasses, shade, when UV levels reach 3 or above, which groups are least likely to use protection, what prevents people from using protection, and what motivates change. On the next slide, you can see our National Skin Cancer Action Week category and summary. So we looked into target audience, which we found that Australians, youth, outdoor workers, parents, and dermatologists. For primary research, they found the YouGov survey on sun safety behavior. For secondary research, we found national cancer statistics, UV index data, and prior SunSmart findings. For data collection methods, there was online survey panels, cancer registry data, media and web analytics. For platforms analyzed, we found campaign website, national news coverage, social media, and downloadable materials. For the research timeline, there was research gathered before November campaign, which is updated annually on their website. And for validity measures, professional sampling, national data sets consistent with year-to-year methods. So further going into National Skin Cancer Action Week, we can see some of their strengths and weaknesses. Their strengths include using solid cancer data and statistics. They conducted a YouGov survey, which is a huge strength, on sun safety habits. The data clearly connects to the prevention goal, which is a strength. The findings help identify behavior gaps across age groups, and the research is recent and population level. Some of their weaknesses are that there's limited public interviews, or at least that I could find. It doesn't show detailed insights for specific subcategories or minorities. The survey details aren't fully shared. It doesn't explain how research shapes the design, and some audiences might be underrepresented in available data, which is similar to the insights for specific minorities. Okay, on to the San Francisco Miles for Melanoma 5K. So some places we're going to explore are who are past participants, what motivates people to join or donate, what prevents participation or fundraising, what communication channels and messaging resonates, and what are logistical and venue-based factors. So the purpose of research is to understand how to engage and mobilize supporters for fundraising awareness, especially around melanoma awareness and prevention. Some of the data sources were event registration and fundraising data, who registered, surveys or interviews, social media, and digital analytics, and benchmarking similar cause events. So here on our test, we tested target audience. We found survivors, current patients, families, runners, sponsors, and partner clinics. For primary research, it was found to be registration numbers, fundraising totals, participant trends. For secondary research, it was melanoma education materials, past event reports, partner hospital info. For data collection methods, it was registration analytics, donation data, social engagement, and attendance counts. For platforms analyzed, it was event microsite, Instagram, Facebook, local news, and partner web pages. And for research timeline, we found the data tracked continuously leading up to race day, summarized yearly, which is similar to our other National Skincare Action Week, was also updated yearly, which is great. And the validity measures, which were accurate event metrics, self-selected audience, and limited behavior validity. Now on to the strengths and weaknesses for the Miles for Melanoma. Some of the strengths were strong event-based data, easy to track year participation trends, uses credible melanoma info from partner clinics and national organizations, and was consistent internal tracking for event planning. Some of the weaknesses were there were little to no structured formula research on audience beliefs and needs. There was self-selected participants not represented of a broader population. No clear measurement of awareness or behavior change, which is similar to the other campaign, and no pre-post surveys of evaluation or learning outcomes. So onto our APR criteria. We're just going to go over the two campaigns and sort of evaluate them. So resources available for information gathering. The National Skin Cancer Action Week showed the data, UV data, and was funded by the survey. For Miles for Melanoma, there was limited event data and partner info. And then the next criteria is sample selection, represents target audience. And for the National Skincare Action Week, you could see that the YouGov survey was designated to reflect Australian population. And for Miles Melanoma, there was only self-selected participants and not representative, so that did not meet the criteria. The next criteria was clear sample size and defined population, which was fulfilled for the National Skincare Action Week, and for Miles for Melanoma, it was event participants only and small narrow groups. For the research timeline, the data collected before November aligns with the UV season, which is good, and for Miles for Melanoma, it was fine for event planning, but not for behavior research. And lastly, confidence in findings. There was a strong epidemiology and professional survey methods for the first campaign, and for the second campaign, there was no behavioral or attitude measures, so it did not meet the criteria. Alrighty, on to planning. For the National Skin Cancer Action Week, they strive to encourage Australians to make sun protection a normal everyday habit when UV levels are 3 or higher. Their objectives are to increase the percentage of Australians who regularly use multiple forms of skin protection. They also want to raise awareness about incidental skin exposure, brief moments outdoors that could still pose a risk. And they also want to partner with schools, workplaces, and community groups to spread the message. Some of their target audiences include entire Australian population, of course, young adults and teens, outdoor workers, parents, children, and dermatologists. Some of the core messages that I found on their pages were that incidental sun exposure adds up, protect your skin every day when UV levels reach 3 or above. They also had a cool slogan, the 5 actions, which can be seen all over their website and their Instagram, which was the 5 S's, which slip on clothing, slap on sunscreen, slap on hat, seek shade, or slide on sunglasses. Just a fun slogan to remember to protect your skin. So their overall goal was to run a strong digital campaign across Instagram, Facebook, and TikTok, supported by TV, radio, and print ads. They also wanted to use local partnerships with schools, sports clubs, and councils to share materials. They provided free resources like social media graphics mainly and some posters for communities to use. They obviously launched it during the National Skincare Action Week, which helps, to follow up reminders throughout the summer. And the timeline is October, where the pre-campaign was built up, November 16th to 22, which is where the national launch was, and December through February was continued reminders of the peak UV season. So for the San Francisco Miles for Melanoma 5K, the overall goal was to raise awareness of melanoma prevention and generate funds and support for the Melanoma Research Foundation via the San Francisco Miles event. So their specific objectives were to achieve a registration target and fundraising goal, increase a team participation and donor engagement, enhance the awareness of melanoma risk and sun safety among participants and their networks. Their target audiences include their primary individuals and teams in the San Francisco Bay Area, so runners, walkers, family, corporate teams, and family groups. And their secondary audience would be the donors nationwide who help with melanoma support efforts and sponsors and corporate partners. So some of their core messages that I found were join us to end melanoma, walk or run for life. Each step raises awareness, every dollar funds research. Another one was come together, make a difference, have fun, and raise funds for a vital cause. Some of their tactics were digital, event web pages, email blasts, social media campaigns. I found a lot more social media campaigns for the Miles for Melanoma versus when I was looking for social media campaigns, mainly on Instagram, for the National Awareness Week. They also had on-site incentives, event shirts, prize drawing, and family-friendly activities, which you can also see all over social media. And they had a fundraising toolkit, social media kit, and team's captain guide. Onto their timeline. Their pre-event, 2 to 3 months lead time for registration, team formation and fundraising, event week, main event day and wrap-up activities, and the post-event where they share results and stories and provide feedback. Some of the risk management was weather or logistics issues, of course, outside in San Francisco, low registration, and then sponsorship and partner dropout. They needed to secure commitments in advance and safety and liability considerations. Alrighty, so on to implementation. So for the National Skincare Action Week, they're developing multiple tactics, online messaging via their website, downloadable media assets, and presumably media press covering the event. They use simple, easy communicated behaviors like their 5S tactic, which can help the public remember and act on. Implementation includes clear calls to action, protect skin when the UV's above 3, check your skin, use sunscreen, etc. So here's some proof of media credibility. You can see I took screenshots from their Instagram pages. Have a clear understanding of population risk, which you can see if you look in on these posts. And then on to the San Francisco Miles for Melanoma. They have online registration, ability to form teams, donate, and join virtually, strong digital implementation. This event includes branded shirts, price incentives, and social media toolkits. They're using the Run to 5K format to encourage the community to participate and raise awareness around melanoma, which blends physical activity with advocacy. And here you can see their proof of media and credibility. I found both their Instagram and their Facebook page, and they had a cool video on the far left of one of their 5K presentations, which was really cool. So here we can compare some criteria for effective health communication between the two campaigns. You can see that the National Skincare Action Week is concise and to the point, which is the same for the Miles and Melanoma, and they're both credible and trustworthy, relevant to key groups and stakeholders, consistent across channels and materials, simple to understand, and descriptive and informative, which you can see that Miles for Melanoma needs more emotional than educational. They're both memorable and easy to recall, and for the social determinants of health, they're not strongly addressed in the first campaign, and there's little to no mentions of social determinants of health in the Miles for Melanoma either. So on to evaluation. So the National Skincare Action Week evaluates its impact using a combination of National Cancer Registry data, UV exposure statistics, and their survey that tracks Australian sun safety habits. These methods give the campaign a strong picture of both long-term trends and current behaviors. While the data is reliable and updated annually, the campaign would benefit from more qualitative feedback, especially from young adults and outdoor workers, to round out its understanding of day-to-day barriers for sun protection. On the other hand, Miles for Melanoma primarily measures success through registrations, fundraise, team participation, and digital engagement. These metrics work well for a fundraising event, but they do not fully access whether the campaign improves melanoma awareness or encourages protective behaviors. Adding the pre-event and post-event surveys and short participation questionnaires would help the organization to track its changes in knowledge and screening habits more accurately. Some outputs, outcomes, and opportunities for National Skincare Action Week. So the article provides data on the problem that 2 in 3 Australians will be diagnosed with skin cancer, which kind of helps to set a baseline. However, the article doesn't supply us with specific metrics or evaluation data about the outcomes. So some outcomes would include like the behavioral change, reduced incidence, or the media reach. For full evaluation, we would want to see those pre-post surveys, the sun protection behavior statistics, or a follow-up data on the skin check update. So the strength is good awareness raising, but the weakness is the limited publicity available for the evaluation data. And then we can see that they show the current fundraising amount and goal, which is measure of success. They don't publicly show how much awareness has shifted, which is interesting. I know that that's hard to record, how many participants were previously or behavior change outcomes, and whether or not they were increased by the skin checks. So there needs to be more public awareness on that. They need to publicly show that. And then there's some transparency of the funds raised, but it's limited on long-term impact beyond the event. For the 5K, our outputs are the number of assets downloaded, media coverage, website, blog traffic, which are not all publicly reported but likely tracked internally, we're assuming. The outcomes are the changes in sun protection behaviors and possibility of long-term cancer trends, public materials, mostly highlighted in the need for improvement, but not measured in changes over time. The campaign consistently reports strong outputs, including attendance numbers, sponsor involvement, and dollars donated to research. While these achievements demonstrate robust community support, the campaign does not measure outcomes related to prevention, early detection, or behavior change. So, to strengthen this evaluation, the organization should track indicators such as skin check scheduling, understanding of melanoma warning signs, which the other campaign does a great job of doing, or increased use of sun protection among participants. So here we can compare the impact, inclusivity, and APR alignment. So on the left, the Miles for Melanoma builds an enthusiastic and supportive community, but it doesn't currently evaluate whether or not the undeserved or high-risk groups are being reached. The campaign's evaluation focuses mainly on event logistics rather than public health impact. To better align with APR standards, the campaign should expand its evaluation to include clear objective tools and measuring them in an annual review process. For the National Skincare Awareness Week, they clearly raise awareness, but its impact on specific populations such as Indigenous communities or Australians in high UV occupations is not well documented. The evaluation does not explicitly account for social determinants of health or differences across socioeconomic or cultural groups, which is similar to the first one. Future campaigns should gather segmented data and partner with community organizations to better understand the needs of these underserved groups. So on to the conclusion. In the end, both campaigns make meaningful contributions, but they do it in their own ways. The National Skin Cancer Action Week focuses on prevention and backs its messages with solid research, which helps people understand the real risks of UV exposure and what they can do about it. There's still room to grow, especially when it comes to reaching groups who face higher barriers, but the foundation is strong. Miles for Melanoma brings people together and raises a lot of money for research, which is very valuable. What's missing, in my opinion, is a clearer picture of how the event actually affects the participants, understanding of melanoma and their long-term habits. Adding a few simple evaluation steps would go a long way in showing its broader health impact. Looking at both campaigns side by side, it's clear that prevention and community support are both needed. If each campaign strengthened the pieces that they're weaker in, they could make an even bigger difference, especially for people who are most at risk. So my overall review is that the San Francisco Miles for Melanoma was a better campaign than the National Skin Cancer Action Week. The San Francisco Miles for Melanoma had a stronger community and fundraising engine. However, the National Skin Cancer Action Week had stronger research and prevention planning. Some key recommendations are that the National Skin Cancer Action Week should publish more segment-specific insights and evaluation. They should use more digital influencer-driven tactics for younger audiences. And for the San Francisco Miles for Melanoma, they should add smart behavior objectives, screening, sun protection, and they should implement systematic evaluations like surveys that they could do before and after or follow-up skin checks. But overall, looking at the bigger picture, combining the National Skincare Action Week, the data-driven prevention with the Miles for Melanoma high engagement events would create a more complete, theory-based skin cancer communication strategy that would help to make the overall picture stronger. So here are some questions that I made up. Question 1 is, how does each campaign talk about skin cancer? What tactics do they use to help shape people think or feel about the issue? When it comes to explaining medical or scientific information, how well do both campaigns break things down for everyday people who may not know much about melanoma or UV exposure? Looking at both campaigns communicate, what do you think they do well and where do they fall short? If you were advising them, what changes would you suggest to make their messages work better? Do the campaigns make an effort to reach groups who might be at more risk or have less access to prevention of treatment? If not, what could they do better to include and support these communities? How do these campaigns stack up against other cancer or health campaigns that you've seen, either in Australia or the US or other countries? Which communication or behavior change theories from class seem to fit each campaign the best? And lastly, how effectively do the campaigns use digital tools like social media posts, videos, or interactive features to reach people that they're targeting? Here I have my references, and thank you so much for listening.